let me give a little background on the scope magnitude. I'm not a healthcare expert, but I think we need to put it in context of the magnitude of this COVID problem, this healthcare problem. And then I want to talk about the impact on the economy in general, the U.S. economy, a little bit of the global economy, and then on impact on the healthcare sector itself, and provide some suggestions for solutions, policies, programs going forward, given the impacts on the economy and healthcare in particular. Okay, if we look at the crisis of the last 2 years, the healthcare crisis, if we consider it a war on the virus, which it should be, although our government has not really been addressing it as such, it is the most destructive war in U.S. history. We have lost maybe 850,000 people. The next largest death from war is the Civil War, about 800,000. World War II, we lost 400,000. World War I, about 200,000. So by far, this is the most devastating war that's ever been waged in the United States. And it's been waged, of course, on our home turf, unlike previous wars. So it's very devastating, very devastating. In 2020, about 220,000 people died in the US from COVID. 2021, at least another 600,000 died. That's about a 2% death rate. About 53 million cases have occurred out of a 340 million population, roughly. Reportedly, 41 million have recovered. So I guess there's about 11 million or so who have not fully recovered from this. Most recently, we see this latest surge, Omicron, much more infectious, maybe, we don't know yet, but maybe not as deadly. 110,000 people are now hospitalized. A real increase here in the last month since the Omicron variant has occurred. Reportedly 600,000 a day, new cases. 140 million more will get infected over the next 2 months by March. So it's not abated. The good news is, of course, we've got vaccines out there, although it's not too clear how effective the vaccines really are, particularly against Omicron. One thing is very clear, that the traditional vaccines like J&J are pretty ineffective when it comes to preventing infections and maybe even hospitalizations and deaths here. They're not even pushing J&J anymore. And of course, globally, that would include traditional vaccines like AstraZeneca, Sputnik 5, and Sinovac. The mRNA seems to be more effective, but not all that effective probably for people with severely challenged immune systems. Or elderly whose immune systems naturally decline. So it is some protection, and certainly it mitigates the severity, but it's beginning to look like we need constant boosters. So the effectiveness wears off. In terms of healthcare spending, last year, well, in 2020, we don't have the figures for 2021, but in 2020, healthcare spending in the United States was $4.1 trillion. Nearly 1 out of every $5 are being spent for healthcare. That compares to 15 years ago, 2004, of 1.8 trillion. So it's up almost well over 200% healthcare spending in the US. The quality of the healthcare received, however, the US ranks quite low among the advanced economies in terms of mortality and so forth, particularly for poor and minority people. So that's kind of the scope of where we are. We've got 5,000 US hospitals in the US, roughly. About 2,800 of those have ICU beds, but almost 1,000 of those now have 95% capacity in the ICU beds. We have 245 million people who've received one shot. That's about 74%. About 62% have gotten two shots, and maybe 30% have gotten a booster. So the war is not won, very clearly. And the war is having devastating effects on the economy, not only short term, because of the shutdowns that we've had, and the impacts on certain sectors and industries, service industries in particular. The impacts are beginning to appear to be permanent. It's not too clear that economists fully understand the permanent impacts on the economy. They're just becoming clear, labor markets, product markets, but they will become more clear over time. There is no returning to new normals here economically, probably not in terms of healthcare either. And of course, the healthcare disruptions and the economic disruptions are feeding into the political instabilities in the United States. I've written about what I call America's triple crisis, and that's the crisis in the political system, particularly democracy under attack, the economic system, long run, and the healthcare system. And all these three are feeding off of each other in a negative way. And it doesn't look as if that's going to discontinue very soon, and may actually intensify. Okay, that's the scope and magnitude, the background of the dimensions of what we got. The main message is COVID is not going away, even if Omicron is less deadly. It certainly is more infectious, and we really don't know with 140 million going to be infected next 2 months, what the consequences are going to be for the economy. Although it looks pretty clear the government doesn't want to spend any more money going forward. That may mean some big problems if the problem with COVID in the healthcare intensifies in any way. Okay, let me move on to the impacts on the economy over the last 2 years, many of which are continuing. First impact, obviously, is on jobs and wages. We saw a massive shutdown in 2020. 35 million people experienced unemployment of some sort during that period. Probably the greatest unemployment impact we've had since the Great Depression of the 1930s. So big impacts on jobs, the number of jobs. Service related in particular, most of the manufacturing continued, particularly food manufacturing during and necessities during 2020 and 2021. The great impacts were on the service jobs, particularly certain sectors, like airlines and travel and leisure, accommodations, hotels, entertainment sectors, personal services, and so forth. That was the major impact, and we're still having trouble with those sectors really returning to their full economic functioning here. So jobs, big problem with jobs. The government statistics, I don't believe picked this up very well. I think the statistical methodologies that existed pre-COVID don't work too well during COVID. They aren't as accurate as they otherwise might be. We hear talk about a 3.9% unemployment rate now. Well, that's only for full-time employees, right? We have maybe 50 million plus people who are part-time temp, not contingent as it's called, gig, and so forth. When you add that group into the unemployment rate mix, we've got maybe 7.3, 7.5% unemployment rate. And then when you add the fact we have 4.5 million people dropped out of the labor force, they're unemployed, but given the way the United States calculates the unemployment rate, they're not considered in the calculation of the unemployment rate. They're jobless, but they don't have unemployment rate influence here. So there's probably 13 to 14 million people still jobless out there. Several million due to childcare unavailability, unaffordability, and a lot of them having quit and in the process of search, what we call frictional unemployment, search unemployment going on. I wrote an article in September called The Great Strike of 2021. Strike should be understood as people withholding their labor, not simply people who are in unions walking out over contract disputes. And if you do that, we have, it's a great strike wave here going on, only comparable perhaps to 1970, 71, or 1945, 40, 46. A lot of people quitting, a lot of people searching for new jobs, a lot of people unable to go back to work still. So the job picture is pretty still very serious. Wages, we look at wages, and again, we have the statistics that are a little bit misleading, I think. We have the consumer price index up 6.8% year over year here the past 12 months. But wages, average wages only up 4.7%. So real wages are going down here during this pandemic. If you compare that to 2019, we had inflation rate of 2.5%, wages about 3%. So real wages were creeping up after a decade of declining here before the COVID effect. But now real wages are going down and quite sharply. That has major consequences for consumer spending, which is 2/3 of GDP in the economy going forward. So, sum up on the labor market situation here, we've got still significant unemployment, and we got real wages declining, which is not very positive here. Minimum wages are creeping up a little bit because they can't get people back into services. The wages were so low, and the minimum wage laws haven't been adjusted except in a few states for so long that they just can't attract the employees anymore. So in certain industries, they've had to raise minimum wages. We're seeing a restructuring of many of these service industries. That's going to be ongoing. They will downsize and restructure in different ways. Labor markets are changing. A lot of remote work, hybrid work is probably a permanent feature now. More frictional unemployment, more structural unemployment. In other words, industry is declining permanently. That's structural unemployment. People quitting and looking, searching for new jobs. That's frictional unemployment. Certain occupations, there's a real dearth of workers, like trucking, construction jobs, and even some service sectors, really shortages going on. So the labor markets are in upheaval and haven't worked themselves out totally, but will continue. And there's a lot of serious problems still in the labor markets as the changes occur to some kind of new normal at some point. Product markets are in flux and stress, even more so, we might add. We know about the supply chain problems. That has two dimensions. That's a global supply chain problem, getting discrete goods, intermediate goods, final goods imported through the ports. I don't think it's totally a port problem. I think that's been hyped a little bit. We hear a lot about the LA port, and they can't unload the containers and ships offshore. Well, you just go north 400 miles to San Francisco Oakland port, and they've got excess capacity there. So, it's the LA port. You don't hear similar problems in other ports. The problem at the ports is not so much or just the ships unloading. The problem is you don't unload them if you don't have the truckers to pick the stuff up. So it's a trucking problem, I think, in the ports, particularly, you know, the 18-wheelers, independent truckers. We don't have enough of them anymore, hauling the stuff inland to the regional warehouses, and from there hauling it to the company warehouses and so forth. And the lack of truck drivers is a longer term problem we have. So we do have supply chain problems, domestic as well as global, and they aren't going away. And you can't fix them overnight. Other industries that we have a problem is, you know, residential real estate. We see shortages of materials and shortages of housing in particular, which is driving the price up significantly. Commercial real estate, we don't hear that much about, but it is in a financial stress. Commercial real estate, we're talking about hotels and malls and office buildings and factories and you know, entertainment locations, theme parks, cruise ships, and so forth. They are in serious trouble financially. And the question remains over the next few years, will they be able to refinance the very significant debt, often of junk quality here, or will they start defaulting on that debt and start having bankruptcies? We could have commercial real estate as the locus of financial instability a year or two from now. So that industry has been significantly impacted. Certain industries are in decline. We know them: airlines, travel, leisure, in other words, hospitality, hotels, so forth, restaurants, entertainment, etc. They will go through a significant restructuring here, and their role in the economy will necessarily decline. Another area that people aren't aware of is what's going on with business investment. We see a surge in business lending and business investment going on. A lot of that, we don't know exactly how much, but a lot of that is in artificial intelligence. Artificial intelligence, simply put, is having software decision-making, software-based decision-making, which will eliminate a lot of the service jobs that are simple decisions. McKinsey and others, Deloitte Touche and others estimate that 30% of all the occupations in the country are going to be negatively impacted by artificial intelligence, which now coming out of the pandemic here is accelerating significantly. It was already significant, but it's just accelerating. So a lot of investment going into AI, because AI will cut business costs by eliminating labor, making simple decisions, and the software-based computing statistical decision-making will be replacing that within businesses. A lot of occupations impacted. I don't think that's an area that's being paid enough attention, but the point is COVID has accelerated that coming out of the problem. Education, we're seeing a lot of remote education that's here to stay, and the impact of that on higher education, particularly smaller colleges, will be severe. Many of them will consolidate and close, I believe. Retail, of course, is going to be impacted because people during the COVID area have learned that it's easier to purchase online than it is to go to a mall. We're going to have a lot of malls closing. So that sector in retail, big box retail in particular, is going to be significantly impacted. All these examples are a part of what's happening with product markets, as we economists call it. So significant impacts ongoing, and permanent restructuring will occur in the product markets, just as they are and will in the labor markets. A lot of this has produced inflation. Inflation has been primarily, in my view, supply side driven, both domestic and global. Is it demand driven? Well, demand to some extent, as the economy has reopened twice here in the summers, particularly this last summer. That means, of course, more people working, more wage income, and more demand for goods. And then, of course, we have the stimulus from this spring. And certain economists are claiming it's, the stimulus, the bills, the American Rescue Plan here, and nothing really happened after American Rescue Plan. Infrastructure bill that's passed won't have an effect for another year. So it's mainly the 1.9 trillion American Rescue Plan of March of this year has added to demand, but not as much as they're saying, because only 900 billion of the 1.9 trillion actually hit the economy in the first year. And of course, the first year isn't over. So when you add maybe in the third quarter of this year, 500 billion from the American Rescue Plan hitting the economy, and you add that to reopening the economy, which is $3-4 trillion more, the stimulus to demand from the American Rescue Plan is minimal compared to reopening the economy. So demand plays some role in inflation, but it's mostly still supply side. And thirdly, I think it's neither supply or demand. It's industries taking advantage of the situation to price gouge, monopoly-like industries. Good example is the meat processing industry and a few other industries where there is no lack of demand or increase in demand significantly, and there is no supply problem, but yet we have 10-20% increase in prices going on. You can say the same with the oil and energy companies. So inflation is a problem here now, but inflation is mostly supply side and price gouging by monopoly-like companies, and to some extent, lesser extent, demand, in my opinion. Going forward, I think there will continue to be supply problems, supply chain problems, because they are structural now in the economy. COVID has upset the economy in permanent ways, and that's one of them. Looking at financial markets, as well as product markets and labor markets, what we see is the Federal Reserve, when the COVID began, threw $5 trillion into the economy through various ways, mostly what's called quantitative easing and other ways. $5 trillion added to its balance sheet debt of $4 trillion going into this. So a massive amount of money was thrown into the economy. The banks did not need the money, but it was thrown at the banks anyway, and major corporations and investors. They didn't need it because they were already flush with cash going into this. This is not a financial crisis like 2008 and 9. So in effect, the Fed pre-bailed out the banks and big investors and big corporations, who then used the money, I believe, significantly to invest in financial asset markets. There wasn't as much demand for their goods, particularly in 2020, to expand production. So the money did not go into expanding the real economy. Most of that $5 trillion, I believe, went into financial asset markets, stock markets, bond markets, currency exchange markets, derivative markets. And of course, what we got was bubbles in those markets. Stock market last year went up, all the three major US stock markets, 25 to 30%, mostly because of all the excess demand, given all the excess liquidity that the Fed pumped into the markets. And of course, all that liquidity lowered the interest rates significantly, and big corporations took advantage of that, did not borrow money from the Fed or the government, although the programs were there as part of the first CARES Act. They did not borrow the money. What they did was issue corporate bonds because rates were so low. It was cheaper for them to raise trillions of dollars. So big corporations got fatter with cash hoarding as the banks got as well. So that sector of the economy, it did quite well. And of course, the result was the financial asset markets boomed, and investors, billionaires, people like Jeff Bezos and Tesla, Elon Musk, added trillions to their asset and their wealth, largely because of the financial asset markets booming, which was largely in turn because of the Fed policies and low interest rates. Now we got the Fed monetary policy shifting. They're going to raise interest rates sooner here, probably in March now, the talk is, instead of the second half of last year. And of course, that will be a negative drain on part of the economy. The problem is you cannot raise interest rates to solve supply-driven problems in the economy. What you do is depress demand, particularly for big ticket items and housing. So the Fed will be making the same mistake as it raises rates that it made in 1980-81 that precipitated the 81-82 recession, when it raised interest rates to 16-18%. They won't raise it that high, but you don't have to raise it that high to have an impact on the economy. At the same time, in terms of fiscal policy, I believe there's no more fiscal policy stimulus forthcoming. We can see that with the stifling of the Build Back Better Act, which is dead. That's not going to happen. They may resurrect a few, cut out some programs and continue them a little bit, but it's pretty clear that there's an alliance in Congress of Republicans and corporate oriented Democrats like Manchin and Sinema, and they're blocking any kind of further fiscal stimulus, which isn't going to happen. At the same time, the Fed raises rates. At the same time that inflation is really devastating real wages and therefore consumption. So going forward this year, the scenario for the economy, I think, is much weaker, and fiscal and monetary policy are not there to stimulate, and consumption, which is 2/3 of the economy, is going to hit some important headwinds, and we may see some financial problems in the markets, in the financial markets. Certainly wealth effects will dissipate as well. Globally, we see some weak links as well. In China, we see the property developers nearing bankruptcy. That could have a contagion effect globally. We see in Latin America and other places, dollarized bond markets are going to be in trouble as currencies decline in those emerging markets as the US dollar rises, right? And we're seeing instability in the crypto and junk bond markets as well. Government debt, $28 trillion, plus $9 trillion of Fed debt, plus probably another $5-6 trillion in state and local debt. The debt load is quite large. They will probably be able to continue to service that debt load for some time, however. So that's the picture of the global and the US economy in general that we're looking at here. Labor markets, to summarize, in flux and not healed. Product markets, some of them in very serious conditions and restructuring. Financial markets, we'll see what happens with the Fed policy changes. Government debt quite high, and no real fiscal policy stimulus forthcoming. And that's going to be a problem, I think, going forward here in the next 12 months. Okay, so what can we say about the impact of COVID here on the healthcare sector, on healthcare in the US? As I said before, healthcare in the US has had a problem for a quarter century here. As prices began to rise in the 1990s, the cost of healthcare, the solution was Clinton's managed healthcare, which was really a way of downsizing the hospitals and the number of beds in the hospitals, and subsidizing hospitals, allowing them, by creating less of a supply of hospitals and beds, to raise their prices. That was the managed healthcare solution. It resulted in a sharp increase in number of uninsured. We had maybe 46, 48 million people uninsured by 2000. That did not decline much until 2008-9. And then we got the Affordable Care Act, which was a further privatization of the healthcare system. Managed care was a first privatization. And the Affordable Care Act reduced the number of uninsured maybe to 28 million from 48 million. So about 20 million people were taken off the uninsured rolls. That's been rising, however, in the last couple of years because a lot of the Affordable Care Act provided deductibles which were quite expensive, really just catastrophic insurance. In a number of states, in other states would fully adopted it, is a little bit better in terms of the cost and the coverage, but very uneasy. And the problem with the Affordable Care Act, Obamacare, is that it costs $900 billion a year to buy down 20 million people, 15 to 20 million people, leaving maybe 25, 30 million people still uninsured in the United States. It's a big cost to not really solve the problem of access to healthcare in the United States. And most of that money was subsidy to the health insurance companies. As one nurse told me, it was really a health insurance company subsidy act in many ways, okay? The good part of it, of course, was Medicaid and allowing a lot of people to get something, even if it's bare bones health care. But of course, a lot of the red states would not participate in that. So it's a very mixed picture. Not privatization solutions clearly do not work anymore. The big thing about what we've got in the last 2 years, I think, is we have a crisis in healthcare employment going on. If you look at the number of nurses, for example, in 2019 in this country, just before the crisis with COVID hit, we had 3.4 million nurses. We've got 2.9 million now. We've lost 500,000 nurses in this country, 500,000 nurses, right? 300,000 in 2020, another 200,000 last year. We can't go forward with chronic problems of viruses, which aren't going to go away. We got a new normal. It's going to be with us for some time here. We can't go forward with losing that many skilled workers in the healthcare industry. In the hospitals, general hospital employment is down 200,000. So there's maybe some overlap there between the 500 and 200,000, but we have somewhere around 700,000 decline in hospital and nursing employment. That's a crisis, given where everything's going in the future. And I haven't seen any government policies about how we're going to train and provide enough nursing and professional care in the houses for this chronic problem going forward. In other words, COVID has really devastated the critical professional jobs in the healthcare industry, and no one is talking about what to do about that. The other major problem that's been laid bare by COVID is the problem with PPE equipment, personal protective equipment. We saw that in 2020, a big problem initially with ventilators and intubators, right? Why? Because they were made offshore. We offshored that production of PPE, and we've seen it with masks and other personal protective equipment. Part of the great massive offshoring and manufacturing, particularly light manufacturing, since the 1980s has included healthcare equipment. And now we got a problem. And there's no real policy to bring it back. No set of incentives and disincentives, credits to bring it back, tariffs for companies that continue to insist U.S. companies to produce offshore, penalties, right? There needs to be a massive program here to get this stuff back on shore. I don't know. I assume test kits are part of this problem, right? We probably need a government corporation to jumpstart production here on an emergency basis, and to give incentives to private corporations to get their act together here, bring this stuff back onshore, because these problems aren't going to go away. So offshoring, a big problem here. PPE, a big problem laid bare. a loss of jobs, critical service jobs in hospitals and nursing, big problem. The other issue is big pharma. Big pharma is here to stay. We have vaccines, and we're going to continue to have new vaccines. We have treatments. The question is, who pays for this? The government up to now has been subsidizing it, but going forward, who's going to pay? And are we going to allow the pharma companies to price gouge us? Will there be some price controls over big pharma in the United States? A big political issue, since they are, one of the largest lobbying sectors of U.S. economy, big pharmaceutical companies, right? So who pays? Who pays going forward? The government's been paying. Who pays, and can you control the prices? The role of government is going to increase, has to increase here going forward as a result of the last 2 years and the continuation. Regulations and mandates, we see the big fight over regulations and mandates going on now. The Supreme Court will probably step in and make some decisions on that. PPE provisioning, I talked about that. The government will have to play an ongoing role subsidizing PPE in some ways. Financing, we dearly need a much wider system of local clinics in this country where people can go and get their treatments and vaccinations and don't have to overload the hospital system, which is getting close to overloading every time this happens. It's almost broken twice. We were pretty lucky. Job training. Is the government going to step in and do more, spend more for job training for nurses and hospital personnel? Financing these clinics, will the government do that? It's not part of the Infrastructure Act, you see. That's a problem. ICU beds. We need a sharp increase in number of ICU beds in this country. We have, 138,000, I've seen, ICU beds for 340 million people. And we almost max them out each time there's a wave. We really need double the number of ICU beds, which means we have to go back and somehow in the clinics or in hospitals increase the number of ICU beds. Right? It's a problem here. We have 110,000 hospitalizations now, with 140 million people more going to be infected. It's hard to tell if those are ICU hospitalizations or not, but it's certainly a significant increase. The other problem I see is the government, on the government side, permanent healthcare impact, is the government, as it takes a deeper role in the whole healthcare sector here, in all the ways I've discussed. It's got to get its act together in terms of its messaging. We see now the media say, well, we got a messaging problem here. There's no real single point of contact here with the government messaging. There's several agencies and press conferences by the White House and so forth. And we're getting a lot of conflicting messaging here, which is confusing people and feeding into the problem with people simply not believing the government and thinking that vaccines don't work, et cetera. We need more science education. We need a single point of communication. For example, the miscommunication or the confused communication coming out. At the beginning, we saw, we're going to eradicate it, zero COVID policy. Now they're saying, we got to live with it. mRNA is 95% effective. We only need 2 shots. Well, then we got a booster. Now they're talking about another booster, 4th shot. J&J traditional vaccines worked. Well, they don't work very well, and they're not even giving them anymore. Children don't get it. Well, they are getting Omicron at a significant rate. Cloth masks are okay. No, now we need N95. 10-day quarantine. Well, now it's a 5-day quarantine. 70%, 80% is herd immunity. They don't know what herd immunity is, right? The vaccines will prevent infections. Well, they don't, and now they're saying hospitalizations and deaths, right? It's a pandemic of the unvaccinated. Well, there's a lot of breakthrough cases going on now. Social distancing, mostly elderly. It goes on and goes on. And this miscommunication by the government is just feeding the bigger problem we have in this country of, I believe, social media and the internet, which is just inflaming the ignorance and the radical right manipulation of the vaccine issue. You know, we have a third of the people who simply won't take 65 million won't take vaccines, even mRNA. You know, social media is a problem. Of course, that raises First Amendment issues, but it's really a kind of a cancer. Social media is a cancer. This is my personal view, but looking at what's going on, I think social media is a cancer that's undermining our political system, undermining our health system, and of course, not doing, as a result, anything good for the economy itself. So something needs to be done long-term about social media. That's not on the agenda, however. But, you know, in the interim of that, the government needs to get its act together and needs to provide a better communications. So the healthcare industry, I would simply summarize, you know, we have a problem with healthcare employment and restructuring. We have a problem with ICU. We have a problem with not enough clinics. We have a problem with offshored PPE. We have a problem with big pharma. Who's going to pay? Are they going to have price controls? We have a problem with investment in jobs and employment and structures that we need to do. Access by low-wage and minority people just don't get the access to the system. And of course, the COVID problem is concentrated there. And then health policy communications is a problem. So those 6 areas I see as a major impacts of COVID on the healthcare system itself. And then prior to that, I outlaid the impacts, permanent, long-term, structural, in terms of labor markets, product markets, and financial markets in certain industries. Okay, I'll just end with that. But you know, the government needs to engage even further with long-term investments, structural investments, not mitigation simply. The first phase here, you could throw money in the CARES Act and the American Rescue Plan Act here in 2021. You can throw money to mitigate the problem, keep it from crashing the economy permanently and even more deeply. But those mitigation fiscal policies are not sufficient. There has to be structural policy, and it's unfortunate that the Investment Act here has not really addressed the healthcare sector investment that we're going to need. And I'll leave it at that and open for questions.